Hi, my name is Emily Holmes, and I will educate my audience about human papillomavirus, or HPV, and persuade them to receive the HPV vaccine and encourage others to do the same. HPV stands for human papillomavirus. It is a group of more than 150 viruses, with some strains leading to cancer. With the technology of today's medical community, we now have a way to prevent these cancers. Today, I will educate you on HPV, the HPV vaccine, and how you can be better informed and educate those around you about receiving the vaccine. HPV is a generic term for a cluster of viruses, as many as 150 strains. The majority of them are benign, ranging from asymptomatic to manifestations of warts. Like the common cold, HPV is, common. In fact, 1 in 4 of us are currently carriers of the virus. Approximately 14 million Americans become newly infected every year with HPV. The good news is that most of us remain asymptomatic. Although someone may not have symptoms, they can still pass the virus on to another person. For those that develop any symptoms of HPV, it's usually in the form of warts. Flat warts, plantar warts, cauliflower warts, the list is endless. Unsightly? Perhaps. Concerning? Not usually. Most of the time, HPV will go away itself within 2 years. What is concerning is that there are several strains of HPV that have been linked to sexually transmitted infections, or STIs. According to the CDC, HPV is the most common type of STI. As many as 79 million Americans, most in their late teens and early 20s, are infected with HPV. There are approximately 40 HPV strains that can affect the genital region in both men and women. Of these strains, numbers 6 and 11 have been specifically linked to genital warts. These warts may be located in the vaginal and vulvar regions of women, penis in men, or anus and rectum. More alarming than the statistics of HPV and STIs is the fact that there is a link between HPV and cancer. In particular, HPV 16, 18, 31, 33, 45, 52, and 58 have been linked to cancer. Literally, the most common cause of an STI can also be deadly. According to the National Cancer Institute, in 2017, there were 19,400 female and 12,100 male HPV-related cancers diagnosed in the U.S. alone. Female HPV cancers include cervical, vaginal, and vulvar cancers, and men, penile cancer, and in both men and women, oral, throat, anal, and rectal cancers have been linked to HPV. By having unprotected sex of any kind, it is possible to get HPV-related cancer. It is important to note that both genital and oral cancers can be caused by other carcinogens, not just HPV. Fortunately, however, is the fact that HPV is one carcinogen that may be prevented, as I will explain next. Now that you know what HPV is, I will explain prevention in the form of a vaccine and its correlating statistics and guidelines. Most of us are aware of the basics of preventing STIs, abstinence, monogamy, and safe sex practices. It's never been more urgent to recognize these as life-saving measures too. Aside from these safe sex practices, the pharmaceutical industry has developed a vaccine that prevents cancer-causing HPV. Gardasil 9 is the only HPV vaccine available in the United States and was first introduced in the U.S. in 2006 by Merck Pharmaceuticals. Initially marketed for young girls, the recommendations have now changed to include boys. According to the Mayo Clinic, the recommendation is for patients to receive a 3-dose regimen. For girls, the initial dose should be given between ages 9 and 11, with the remaining 2 doses by age 26. For boys, the first dose at age 9 and remaining doses before age 21. By doing so, the rates of HPV transmission among sexually active teenagers will be significantly reduced. Ever since the vaccine was introduced in the U.S., infections of HPV-related cancer and HPV-related genital warts has decreased by 71% in female teenagers. All states offer the vaccine series, but only Rhode Island, Virginia, and Washington, D.C. has made it part of the school attendance mandated vaccines. More states are initiating legislative proceedings to do the same. It is better to receive the vaccine now than to treat a preventable HPV-linked cancer in the future. In fact, 31,200 cases of HPV-related cancers in 2015 could have been prevented had these people received the HPV vaccine. As with most vaccines, there are always going to be concerns. Because this is a vaccine series given later in life, any perceived link to spectrum disorders is negated. The side effects of Gardasil 9 are localized pain, redness, and swelling at the injection site. More significant and less likely are dizziness, fainting, nausea, fever, and headache. These side effects are minimal and certainly outweigh the risk of developing cancer later in life. You now know about HPV and a vaccine to prevent HPV-related cancers. So here's how you can encourage others to become educated and choose to be vaccinated. Patient education is the best way in which we can learn more about HPV and preventing HPV-related cancers. Knowing that a vaccine is available that can literally save lives is a positive first step. Taking additional steps to vaccinate our children and ourselves is imperative. There have been many campaigns by big pharmaceutical companies and health organizations to encourage people to receive the HPV vaccine, and for those people to encourage friends, loved ones, and children to get vaccinated as well. Something rather poignant, and which many of you may have already seen, is the ad campaign for Gardasil. Sponsored by Merck, it's an emotional plea for children to their parents to vaccinate against HPV to prevent cancer.
I have cervical cancer from an infection, human papillomavirus. Who knew HPV could lead to certain cancers? Who knew my risk for HPV would increase as I got older? Who knew that there was something that could have helped protect me from HPV when I was 11 or 12, way before I would even be exposed to it?
Did you know, Mom? Dad?
Pretty powerful to say the least. And as millennials are becoming more outspoken as to their wants and needs, they too are recognizing that they have a voice, especially when it comes to their own health and well-being. Those of us who are still within the age range to receive the vaccine should do so. If we have loved ones coming of age, it should be something we speak up about. Our lives may depend on it. As with everything, the more educated you are, the better equipped you are to make informed decisions. Encourage people you know to make the right choice and get vaccinated against HPV. In conclusion, you have seen what HPV can do and the steps towards preventing it. Knowing now that HPV is the most common STI and a cause of cancer is powerful knowledge. Knowing too that there is a means by which we can prevent cancer is even more empowering. We owe it to ourselves and our future generations to do all we can to prevent HPV-related cancers, and if all it takes is literally 3 shots, it's well worth it.